today about what we know about FASD prevention and treatment and support. And I just want to start by saying that, this is such a complicated territory that really, since the 1990s, I've always start presentations by saying, we need to think about the values that we come to this work with. And we have been using these four: respect, understanding, compassion, and hope as really helpful values to bring to our work on FASD, both with women who use alcohol and individuals with FASD and their families. So here's what I'm going to do. I'm going to talk a little bit about FASD, talk a bit about its prevention, talk about diagnosis and support, and then just end up with a bit of recognition for caregivers and adults with FASD, and a couple of slides on how people might be able to become involved in action on this if they're interested. In the prevention and diagnosis and support sections, I am going to talk a lot about what we know and also promising directions based on what we know. And I'm really in that process going to stress the balance between what we know from research and what we know from lived experience. So we're really trying to blend those in all we do. So let's talk a little bit about what FASD is. The big change, I think, in the last few years in what we know is this move from seeing FASD in very stigmatizing and deficit-oriented ways to seeing both strengths and challenges, and to proactively talk about what supports are needed. So you can see there it says need support with motor skills, physical health, learning, memory, attention, communication, emotional regulation, and social skills in order to reach full potential. So really, I think that is our big, one of our biggest shifts in thinking about it. It's a really complex disability. It has primary impairments in various brain domains I'll talk a bit more about as we go along. It also has a lot of adverse outcomes that are connected to it when we don't have the kinds of personalized and systemic supports that people need. And then finally, there's this whole bunch of really big bunch of co-occurring conditions that include a lot of physical health issues. And those, are often we're calling now these whole body effects. And, we have gotten much more knowledge about those because of a group of young people with FASD who developed a survey with the help of some research to understand the health conditions they were experiencing. And they found a lot of conditions that people with FASD experience at a really very much higher rate than people in the general population. And those include, and these are just a couple of them, autoimmune disorders, sensory problems, sleep disorders, and difficulties involving bones and muscles and joints like scoliosis and joint pain, etc. So a shout out to Miles Hemlick and all the others who worked with him on this, this survey to help us better understand the whole body effects. Now, we don't have as much research as we should on the strengths part, but here's one example of a research study that found these various strengths and abilities really shining through from those individuals with FASD. Having a strong self-awareness, having receptiveness to support, having really great capacity for human connection, having perseverance through their challenges, and hope for the future. I just think it's a lovely summary of some of the strengths of those with FASD. And this group, the Pautiti Inuit Women of Canada, have created a really amazing campaign to encourage people to see FASD as a brain difference and to see, as they say, all brains are beautiful. And I really encourage you to look at this wonderful campaign that they have put together. And others like the Saskatchewan Prevention Institute in their work around Let's Change the Conversation campaign has also brought a real focus to strengths rather than deficits. So, I cannot begin to talk this morning about all the ways of understanding FASD for different genders, different ages, etc. But I really encourage you to go to this site if you're interested, called No FASD, that introduces the neurobiological differences that may appear throughout the lifespan of individuals with FASD, and it offers what might happen with the right intervention and provides links to resources, etc. So a real shout out to Dr. Jackie Pye and many of the others who've worked with her at the University of Alberta to get that in place. Now, she has also led the development of this resource that is about the substance use treatment field and how they can be FASD informed. And it provides, for example, within it, an excellent view of how young people and adults with FASD may present in key areas like language and memory and attention and learning and participation and emotional responses and adaptive functioning. And they talk about, for the substance use field in this case, what you might see in the treatment setting, why you might see it, and what you might do. And I just think this is just the example in the language section. They cover all these other sections as well. So you might see someone say they understand or agree to a plan, but then they don't follow through. And then, having the explanation of why you might see that and what you might do to help the person meet their plan in a way that is FASD informed. So really encourage you to think about that or follow up on that. But, having said that, everyone is different. And each person with FASD will have unique strengths and challenges. And there's no one size fits all for people with FASD. So that's my quick dash through what we know about FASD as a disability at this point. So let's talk a bit about the prevention side of it, and then we'll go to the intervention side. So we absolutely know that there's no known safe time to drink in pregnancy. There's no known safe amount. Even low levels of use can have negative effects. It doesn't matter what kind of alcohol, and there's a whole bunch of other risks that surround the alcohol issue. So while we can't predict a level of alcohol exposure that is harmful for a specific fetus, we do know that heavy or binge drinking clearly increases the risk. And we also know that even low amounts can have adverse effects. So all of our guidelines indicate that it's safest not to drink when planning a pregnancy, during pregnancy, and when breastfeeding. And I and a bunch of other researchers went back to the literature to look once again at the science behind all this to help the Canadian Centre on Substance Use and Addiction and some of the CAMH folks together develop the new guidance on alcohol and health. And we again found this, that it's safest not to. So why would women drink in pregnancy? There are so many reasons. Some of them are informational, some of them are stress related, and some of them are about addiction itself. So lots to think about how do we design prevention programs, and really trying to think that not focusing narrowly only on the alcohol use itself, but the surrounding determinants of health and factors that increase the risk when people use substances in pregnancy. So your nutrition, your access to prenatal care, your stress level, your overall health, your experience of loss or isolation, how our policies on mothering interrupt access and support. So lots to think about as we design prevention programs. But going into it again, just wanting to stress this idea that there a huge misconception is that mothers who use alcohol in pregnancy are somehow thoughtless or not trying or resisting assistance. And I interviewed some mothers at the Her Way Home program in Victoria, and they offered some great advice. Number 5, be a support, get behind us. Number 6, listen, be curious about what might work for each of us. Number 7, be educated. There are a lot of things that play into addiction. Number 8, just because you're still using does not make you a bad mother, etc., etc. So lots to think about as we design these programs. And those of us on the system level really need to think about how policies affect the capacity for us to prevent FASD, and that women's fear of child apprehension, the lack of women and family-centered programs, and the lack of coordination in governments between child welfare and substance use and justice, and all the education, all the different departments who could be coming together to make a coordinated response. So here's what we've come to over time, is that we need to do these things all together in a way that is coordinated. We need to be raising awareness, level 1. We need to be talking about alcohol use and related risks with all women and gender diverse people of childbearing years and their support networks. We need to provide specialized, holistic support of pregnant women with alcohol and other health and social problems, like we saw on that previous slide. And we need to keep supporting after birth and provide support for new mothers and support for child assessment and development. And, grounded in supportive alcohol policy and child welfare policy and many other policies, housing policies, all these things. So it's not a simple thing of holding up a pamphlet and saying, just say no. But the pamphlets are important because there are informational needs. We all need to know about the risks of alcohol use in pregnancy and find really engaging ways, like the groups on this slide, about what we can do. I think it's just incredible, some of the wonderful health education materials that various provinces and territories and organizations have developed. And we can be using the low risk drinking guidelines, yes, and we could be having alcohol warning labels and various other things as well. Community health promotion efforts like we're going to be doing on September 9th, etc. So this awareness building part is really important. Equally important is this level 2 part, where we talk to all women about the risks and support them. in making changes. And, this is something we've often in the past really thought about the medical field as being about, but we need everybody behind these kinds of discussions. And one of the challenges in the medical field and is making the kinds of screening, brief discussion, etc., really trauma informed, culturally safe, harm reduction oriented, and women centered and person centered. And I think we have, still a big challenge here because women are often afraid to disclose their alcohol use. Physicians and others often don't feel fully prepared to discuss it or how to really help people with paced and achievable change. And all service providers may really be reluctant to discuss alcohol, fearing that somehow they're going to turn people off. But there is research, especially from Australia, that shows that women want to know and they're interested in having the discussions, and that really we need to get over our kind of stigma and concern about talking about alcohol as a society and really have these kinds of discussions. We at the Center of Excellence, with help from people in every province and territory, developed this Doorways to Conversation document for those of you who are interested in how we might really advance the discussing alcohol with women. But again, all of you, every parent, every service provider of every kind could really be there using these evidence-based practice of working to understand the benefits of substance use, encouraging small steps, dispelling myths, keep discussing, keep encouraging. This is not rocket science. It doesn't take a professional to do these kinds of things only. All of us can be part of this, talking about it. What we know now is that there are lots more people working on those two areas that we didn't work on in the past, which is helping people reduce their substance use before they know they're pregnant or when they're planning a pregnancy in the preconception period, and also helping people really reduce the high risk drinking, the binge drinking, and practicing birth control as well as reducing drinking as good practice. So really, there's so much promising going on in terms of educating and bringing about change. Okay, the level 3 part, the holistic support, the wraparound services. We've just finished an amazing study, the Co-Creating Evidence study, looking at 8 programs across Canada in the community who offer pregnant and parenting women with substance use concerns all these kinds of supports in a kind of a one-stop way, helping women choose what they think is important as their place of beginning on the journey and really achieving great outcomes. And that wraparound model is also being used in Indigenous communities as well, and with the integration of cultural safety as well. And so this document at the bottom there, called Revitalizing Culture and Healing, talks about 7 Indigenous community-led programs in BC who have really developed amazing community-based services driven by culture, language, land, lineage, ways of coming at FASD prevention. So it doesn't say FASD prevention at the door. It talks about wellness, strength, independence, self-determination, and healing. And 20 years of research has shown us that this matters, that these kinds of programs, these wraparound community-based programs, support early engagement, really improve outcomes for women and children. that women who participate in these programs are more likely to keep custody and have higher rates of accessing addiction treatment, and children who are involved with their mothers in these kinds of comprehensive programs of support have enhanced developmental outcomes. We still have a lot of research to do in this area, but it is so promising. So I know in Ontario, there are lots of key worker type programs, and these kinds of programs of home visitation, parent-child assistance program, and key workers have also lots of evidence to support women, children, and families and communities in the postpartum and ongoing towards school age time. Really important. 4 levels of prevention, needing coordination from the policy folks as well, so that we can find ways of the substance use field doing their part and other fields like the child welfare doing their part, and finding ways of how both sectors can support attachment and the social and material needs of women. So just so promising, the area of prevention, about what we know and how we can make this 4-part prevention model happen using fundamental components like respect and using relational methods, supporting self-determination, harm reduction oriented, trauma and violence informed, culturally safe, supportive of mothering, and using an FASD informed and disability lens. So you can see I'm passionate. I could go on for half an hour longer about this, but I'll turn to the diagnosis and support part for another bit of time here. Our Canadian experts have developed guidelines for diagnosis that are internationally recognized. And they've also developed a national database that captures data from diagnostic clinics across Canada. And this data is helping us better understand FASD, and in turn helping us to build and connect people to the services that are needed. So we are world leaders in understanding FASD and linking now through the CAMPAS project and other things about what works, and as we link people to various interventions. Here's where we are in terms of the intervention story, is really thinking again about principles for practice, consistency, collaboration, responsiveness, and proactivity as we do this work. It is so complex and so important and so doable if we actually really take that collaboration piece to heart. And I just want to send you all who are interested in intervention and support to this document, again developed by Dr. Jackie Pye and others at the University of Alberta and the CanFASD Research Network. There is a wealth of information on intervention and support in this document called Towards Healthy Outcomes. And it's really a lot about targeted skill growth and development, and also shifting environmental supports and shifting expectations so that people can really succeed. And it talks about 10 domains where we can be supporting people with FASD. You can see them there in attachment and relationships, physical well-being, social competency, mental wellness, identity development, education and skill building, interdependence, employment, parenting, housing, you name it, across all the various life course time periods. is so well informed by the wisdom of caregivers and those with lived experiences, as well as researchers, and is really given us a lot of ideas about pursuing healthy outcomes at all levels. The core beliefs in that Towards Healthy Outcomes report are about individuals with FASD being capable and able to contribute meaningfully to their communities, about having both strengths and needs, about having voice, about having how our relationships and connections influence developmental outcomes, and really important that we have shared understanding. So really amazing rethinking and positive, goal-oriented thinking about where and how we can support individuals with FASD to achieve their best outcomes. There's also individual intervention research being done. Here's an example of a small research study on self-regulation, and really an intervention, the ALERT program, an intervention focused on self-regulation and exploring the use of self-regulation strategies in adolescents with FASD. So again, really a lot going on behind the scenes for us in learning about how best to support people with FASD. But I think our challenge right now is being FASD informed in every service sector. Because a lot of our service models are choice-driven and they're reliant on memory and reasoning skills, and therefore they need adaptation for individuals with FASD. And this recent report I mentioned earlier is just an amazing one, designed to support the substance use treatment field, to tailor substance use treatment responses for people with FASD. But there's lots in it for all service sectors to think about this. The folks at CanFASD have really been thinking a lot about supporting all the different sectors, and they've created tools for healthcare providers in being informed about FASD, including algorithms for what pharmacological agents might be helpful, or without over medicating, etc. They have done a lot of work in the area of child welfare and how we can be doing assessment and early interventions for children in ways that really, support effective case planning and minimizing risks. And this has been a long time coming, really solid work to see FASD as a disability meriting all kinds of supports, but definitely movement. And just again, a shout out to the Indigenous communities who are designing models around support that is culturally appropriate. And this Dreamcatcher model from folks developed in the New Brunswick area of Canada, the Mi'kmaq, and other nations, really thinking about empowering community workers who interact with clients with FASD, and promoting collaboration and respect, and really doing the work to decolonize this territory. So, tons of work being done. I just want to, in the last couple of minutes here, before I turn it over to you to ask questions and comment, is to give a shout out to caregivers and adults with FASD. just going to start with the adults. And I think one of the things that we, have not done enough on is to think about this as a lifelong disability and to really, move beyond only providing supports for children and parents when they're raising young children with FASD, but to really think about how we are supporting adults throughout the lifespan. And the Lakeland Center for FASD has done an amazing amount of work in this area, increasing access to diagnostic services so that people can get a diagnosis as an adult and have supportive housing and have outreach support services and have, access to employment and day programs and social connections, etc. So really, really important that we think about adults as well in this. And wanting to mention the adult FASD expert collaboration team of CanFASD that has been developed to make sure the voices of those with FASD are included in the research that we do. And we have so much to thank them for giving us their wisdom and helping us design research and involve them in research in ways that really takes us a lot farther. But encourage you to think about this in all provinces. Here's a Manitoba example around the visions and voices, where we listen to those young adults who are doing a speakers bureau to help us raise awareness and evoke our action on FASD. And the caregivers, I hope there's tons of you who've joined today because, wow, what an amazing contribution you make for all of us every day. And I just really recognize your valuable experience in helping the folks you are caring for find agency and also support, finding that balance, what we call interdependence in the Towards Healthy Outcomes framework. That idea of, supporting as to the degree that people can based on their particular experience, and really also recognizing that we're not looking for people with FASD to be totally independent, but to find that balance. And it is amazing what caregivers have told us about their experience of helping young people as they start school or change school or become an adolescent or transition to adulthood or become a parent, and how the role of caregivers is so central to it. And I think so central to us as service providers and researchers to listen to what is needed in terms of research and support. So I just want to give a shout out to the caregivers as well, that I just think that you deserve support in this whole process too, that is trauma informed and culturally safe, etc. And really are getting access to the self-care and the systemic supports that you deserve, and the connection to other parents. And we've really tried to create that through the Family Advisory Committee at the CanFASD Research Network. And I know CAMH, through this group that's sponsoring this webinar today, is also really interested in this area, and just really want you to recognize how critical that is. And to connect you to Jeff Noble, if you're interested. He's just an amazing guy who does a great podcast and other work that is all about hope and education for caregivers. So, just to wrap up, I just want to say, please do get involved in September 9th in any way that you can in your community, because it matters that we all get connected in and, as they say here, shape a society that supports healthy pregnancies and people with fetal alcohol spectrum disorder. So hopefully you are already connected or can find ways to be connected. One other way of getting involved, I think, is being part of the movement to encourage the federal government to develop and fund a national FASD strategy. Because it's such a complex disability, we need a coordinated plan across all Canada for prevention, intervention, and diagnosis. So we really encourage you to get connected to movements in your province or to your member of parliament to talk about the importance of a national strategy. And finally, just want to mention in Toronto in October of 2025, there is going to be a Canada FASD conference, and I really hope that all of you think about getting involved. So thank you.